Hi, my name is Dr. Meghan Marcum, and I'm a clinical psychologist at Orange County Psychiatry and Addiction Medicine. Wanted to talk a little bit about mental illness, mental health, and more specifically about depression. So first, I wanted to just highlight the importance of taking care of yourself in terms of mental health and use an example. Let's say you were having trouble with your eyesight and it got worse over a couple of weeks, you probably would see a doctor right away. Well, the same should be true with your mental health. If you were feeling super anxious or like your mood's just not quite right for a few weeks or so, it's equally as important to go talk to someone about what's going on. Physical illness looks very different than mental illness. With mental illness, there are no open wounds or cuts that we can see, so it's sometimes more difficult to recognize the symptoms. I wanted to talk a little bit about depression and share with you some of the symptoms. So when we think about depression, most of us typically think about people who are depressed have, a bad mood. They're sad all the time. And certainly that does correlate. If you feel like your life is very hopeless and you have thoughts about not wanting to live anymore, or maybe just intentions on not living anymore, then that is a major red flag for depression, and I would encourage you to ask for help and see a professional right away to talk about treatment. There are a lot of other symptoms that are a little bit more unclear, more difficult to recognize, and some of those include problems with your sleep or problems with your appetite. So let's say you find yourself having a lot of problems falling asleep or staying asleep, or you're sleeping way more than usual. That can be a symptom of depression. Same with your appetite. If you just feel like you don't want to eat very much at all, or you're eating way more than you usually do, that's another sign. Another one is if you're feeling like you just don't have a lot of enjoyment in life. Your old hobbies don't seem fun. You don't want to go and hang out with your friends. You really don't want to come out of your room or do anything. Life's just kind of blah all around. That's another sign that you might be depressed. Another one that's kind of difficult to recognize is if you're having trouble with your attention or your memory. Maybe your work performance has been slipping lately. That can also be a sign that maybe something's going on with your mood. So, if you think about those things, and if some of them seem like they fit you or someone that's really close to you, then I would encourage you to make an appointment with either a mental health professional or your primary care doctor to talk a little bit more about it and see if maybe there's some treatment options that are appropriate. All right, well, with that being said, I want to just open the lines of communication. If any of you have a question for me about depression or want to know more about treatment options, then you can send me an email at the address that's on your screen. And also, I just wanted to say one more time how important it is to take care of your mental health. So just please make that a priority. And that's it. Have a good day. And that's it for me. Thanks.